On his first full day in office, President Biden focused on one of his top priorities, combating the coronavirus pandemic. The president signed a number of executive orders and directives on Thursday. The White House says the actions are the first step in a national strategy to increase vaccinations, enforce mask wearing, and reopen schools. That new strategy comes as some cities and states say they are running low on doses of the vaccine, as well as the supplies needed to administer the shots. But the administration's new strategy will take time to implement. President Biden says the country should expect things to get worse before they get better. It's predicted that there will be another 100,000 coronavirus deaths in the U.S. by the middle of February. CBS News Chief White House correspondent Nancy Cordes has the latest.
This next one is setting up the pandemic testing board.
President Biden put a pen to his promises today, even as he slammed his predecessor.
For the past year, we couldn't rely on the federal government to act with the urgency and focus and coordination we needed. And we have seen the tragic cost of that failure, 3,000 to 4,000 deaths per day.
One of the new executive orders mandates the use of masks in airports and on planes, trains, and intercity buses. Another invokes the Defense Production Act to speed production and delivery of COVID tests, masks, and other PPE. The president also released a plan to establish national standards for vaccine distribution and school reopenings.
It is so detailed, it is over 198 pages.
Without clear federal guidelines, states and cities have had to craft their own COVID plans. A rocky process marked by vaccine delays and canceled appointments.
Needless to say, I wanted to cry just because I never thought I'd be so excited to get a vaccination as I was for this one.
And let your arm go slack by your side.
Biden aides concede they are unlikely to meet their goal of 100 million vaccines in the next 100 days unless Congress provides another booster shot. The new administration is pushing a $1.9 trillion package with funding to build community vaccination centers and to hire 100,000 public health workers.
We'll also task the Department of Health and Human Services to prepare and expand the pool of medical professionals who can administer the vaccine.
Mr. Biden was joined today by a familiar face, his chief medical advisor, Dr. Anthony Fauci, who frequently disagreed with President Trump.
No, he's been wrong on a lot.
Today, Fauci said his new boss has a very different management style.
One of the things that was very clear as recently as about 15 minutes ago, when I was with the president, is that one of the things that we're going to do is to be completely transparent, open, and honest. If things go wrong, not point fingers, but to correct them, and to make everything we do be based on science and evidence.
And while the 45th president often made rosy predictions about the virus,
it's going to disappear, it is disappearing.
Today, the 46th vowed not to sugarcoat the facts.
The brutal truth is, it's going to take months before we can get the majority of Americans vaccinated.
And our newly appointed Chief White House correspondent Nancy Cordes joins me now. Nancy, President Biden's coronavirus response coordinator says the situation that they inherited from the Trump administration is far worse than they could have imagined. What are some of the major shortfalls that the Biden administration says that they are now trying to overcome?
Well, the major thing that they've taken issue with is the fact that there was not a universal set of standards that states and cities could draw upon when crafting their own plans. And so therefore, you have sort of a patchwork of different plans all around the country. And it's really a heavy lift for some of these smaller states and cities in particular to try to craft an approach this quickly when they don't have the same kind of deep expertise as the federal government might be able to bring to bear to this problem. So what the White House is trying to do is not dictate to every state exactly what they need to do, but to at least say, here's what we think is the best practice for you. And so to sort of bring that expertise, put it all in one place so that states, when they're trying to decide, okay, when can we reopen schools? How do we vaccinate the population? Who goes first, second, third, fourth, fifth? How do we ramp up testing? Who do we test? All those questions that had previously been left to states to figure out, the Biden administration is coming in this very first week and saying, here's our plan, here's our proposal, take it and implement it if it helps.
Well, much of the Biden administration's strategy for combating the pandemic seems to be relying on Congress passing his nearly $2 trillion relief proposal. How soon could we be seeing that proposal sent over to Congress? And Nancy, what are some of the points that could hold up the bill?
Right. So it's already getting some pushback from Republicans who say, look, we just passed a $1 trillion package. We're not in the mood to consider another $1.9 trillion spending bill. And they're urging the White House to go back and pare it down. White House officials aren't saying that this is set in stone, that it's 1.9 or nothing. But, they argue that there are two prongs to this package that are hugely important. First of all, you've just got stimulus for the economy, money to state and local governments, it's schools, and another big cash outlay to American families who are hard hit from the pandemic, may have lost their jobs, more unemployment funding and the like. So that's one side of this package. The other side is money to help with the response. So you've got, for example, funding to immediately hire 100,000 healthcare workers so that they can be dispatched all across the country to help with vaccinations, with testing. Because one of the big problems that a lot of these states have run into is they've got vaccine, they've got the ability to set up an appointment system so that people can come in to get the vaccines, but they don't have enough people to administer the vaccines. That has been a big bottleneck. So there's money in the bill for that. There's also money in the bill to very quickly, maybe within a month or so, establish mass vaccination sites around the country that could be built by FEMA, the federal government, coming in and either, sort of brick and mortar locations, tents, things like that, so that you could bring a lot of people into a site to get vaccinated very quickly, or mobile sites for, more rural areas where it isn't as desirable to have, for example, one static location, but perhaps, some kind of mobile system where you can get around to small towns and vaccinate a lot of people. At the current rate that people are being vaccinated, we're looking at a much longer time period where people are going to have to be wearing masks, where they might not be able to go to school, where they might not be able to go to work. And so the goal is to ramp up that vaccine delivery so that people can get back to their normal lives as quickly as possible.
Yeah, you mentioned the mask wearing. President Biden has been emphasizing that. Can you tell our viewers a little bit about the mask mandate that he signed as an executive order? How much is the measure largely symbolic versus actually able to affect a real difference? And Nancy, might the president try to push states to enact their own mask mandates now?
Yes, I mean, this has been one of his most consistent messages. He wants everyone wearing masks. On his first day, he signed a mask mandate on federal lands and federal buildings. And then on his second day, this is a mask mandate at airports, on trains and interstate buses and planes. And the reason for that is that there's been a lot of resistance among individuals to wear masks, particularly in public settings like that. And so what this does is it just gives a little more teeth to a lot of regulations that have been put in place by the states or by individual air carriers who often face problems when passengers don't want to wear a mask on a flight, have to be taken off and the like. One of the cases that the president was making was that actually mask wearing could be more beneficial to the coronavirus count than vaccines at this point. And so that is a message you're going to hear over and over again from this administration.
All right, Nancy, thank you.
You're welcome.